At Meds Plus Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, Meds Plus Consulting Pharmacy and Wellness Center.
Hey everybody, hello. It is Monday at 1 o'clock, which means it's time for Meds Plus Medical Minute. I'm Dr. Pauline, and I will be your host today. And this is our last medical minute of Heart Month. And we are closing it out talking about something that affects nearly half of all adults in America, hypertension, also known as high blood pressure. Now, here's the reality. Nearly 1 in 2 American adults have high blood pressure, but only about 1 in 4 have it under control. That means many people are walking around every single day with numbers that are too high, and they don't even know it. That's why hypertension is often called the silent killer, because usually you don't feel it. There is no alarm, no warning pains, no flashing lights, but internally, damage is happening quietly inside the body. So let's talk about what those numbers actually mean. According to the American Heart Association, normal blood pressure is less than 120 over 80. Elevated is over 130. And stage 1 hypertension starts over 130 over 80. A hypertensive crisis is 180 over 120. Now, we've been out in the community doing screenings, clinics at churches, community centers, and we've seen barbershops, and we've seen people with numbers that were well above 130 over 80. And these people were walking around with elevated stage 1 and stage 2 hypertension. So I want to leave this chart up for just a minute for you to see, again, that normal is less than 120 on the top and less than 80 on the bottom. So if you've been going to your doctor, and these are relatively new guidelines, so if you've been going to your doctor and they've been saying, okay, your blood pressure is 130 over 84, that's okay. It is okay, but as a patient and concerning your health, it is something to monitor and watch, because if it continues to go up, you may need to be diagnosed with hypertension and placed on medications. So it's important not just to get your readings done at the doctor's office, but at home as well. Even slightly higher elevated blood pressure over time increases your risk of severe disease. So let's bring this home. Here in Alabama, we consistently rank among the highest for heart attack, heart disease, and stroke. Cardiovascular disease is still one of the leading causes of death in our state and nationally. So it's not just a national issue. This is a local issue right here in Birmingham, affecting our families, our churches, our workplaces, our communities. So what happens when blood pressure is not controlled? Over time, it can lead to stroke, heart attack, heart failure, chronic kidney disease, vision loss, cognitive decline, and sexual dysfunction. Just think about everywhere you have blood vessels in your body, hypertension can lead to complications in those areas. High blood pressure damages blood vessels. It makes your heart have to work harder. It affects the brain, the kidneys, and the eyes. And the dangerous part is that oftentimes you feel completely fine until you don't. That's why prevention and monitoring are so important. So let's talk about checking your blood pressure properly at home. Before you check your blood pressure, you want to make sure that you're sitting quietly for at least 5 minutes. Make sure that your feet are flat on the floor and that your back is supported and that your arm is at heart level. Don't talk during the reading. This is important to avoid caffeine or smoking at least 30 minutes before your reading. And make sure you use the correct cuff size. If the cuff is too big, it can inaccurately lower your blood pressure. If the cuff is too small, it can inflate your blood pressure. You want to take 2 readings about 1 minute apart and record the average. I'm going to show you a quick video on proper technique of taking your blood pressure. Uh-oh, my video is not loading. Hold on just a second, y'all. There we go.
Today, we will be going over how to use your blood pressure monitor. In today's video, we will be going over everything in your monitoring kit as well as a tutorial about your kit. At the very end, we will show a hands-on demonstration on how to use your monitor. Before getting started, make sure to sit still, relax, and keep your feet on the floor, and do not talk while taking your blood pressure. We will now go over everything in your kit as well as the tutorial. In your box, you will receive a monitor and 4 batteries. You will need to take the case cover off and insert the 4 batteries into the bottom of your device. Here is a hands-on demonstration on how to use your blood pressure monitor. Before getting started, make sure there is no thick clothing around your bicep so you can get accurate results. When you put your blood pressure cuff on, remember to keep the cuff tube in the middle of the forearm. You will slide the cuff on your arm and make sure that the cuff is above the bend of the elbow. When tightening your blood pressure cuff, make sure that the tube is still aligned to the middle of your forearm. Once your blood pressure cuff is securely fastened to your arm, you can press start on your device. While your results are being recorded, make sure to remain seated, breathe steadily, and keep your feet flat on the floor. After waiting a few seconds, your results will appear. You will be given your systolic value, your diastolic value, your pulse per minute, as well as the time that your results were recorded. Once you are done recording your results, you can press the start/stop button and remove your cuff from your arm.
All right, everybody. How to properly check your blood pressure. And that's so important because we need accurate information in order to determine whether your whether you need to be put on blood pressure medicine or whether your blood pressure medicine needs to be changed. Now, I also want to let you know about 2 conditions. One is called white coat hypertension. And that is when your blood pressure is high at the doctor's office, but normal at home. This is a common thing where people go to the doctor's office and their blood pressure is high, but when they check it at home, it's normal. That's why it's so important to record your blood pressure and check your blood pressure at home. The other condition I want to talk about is called masked hypertension. And this is when your blood pressure is normal at the office, but it's high at home. Masked hypertension is especially dangerous because it can go undetected for years. That's why home monitoring is so powerful. Now, let's take this a step further. Remote patient monitoring, or RPM, is where healthcare is evolving. This is new and up and coming in healthcare. So instead of waiting 3 or 6 months for your next appointment, you check your blood pressure at home. Your readings are automatically uploaded into a portal, and your clinical team reviews the trends in real time. If adjustments are needed, they can be made sooner. This means fewer strokes, fewer ER visits, better control, and better outcomes. Technology allows us to be proactive instead of reactive. Now let's talk about blood pressure medications. There are several classes of medications to treat high blood pressure. You have ACE inhibitors, ARBs, diuretics, calcium channel blockers, beta blockers, and on and on. And the truth is, many patients require more than one medication. That is completely normal. We see so many people, whether in our pharmacy or in the community, that are concerned about the number of blood pressure medicines that they're on. It's important to note that hypertension is a chronic condition that can lead to very detrimental complications, but it can be controlled, and oftentimes it needs to be controlled with more than one medication. So it's not about weakness, it's about physiology. And one of the biggest mistakes people make is stopping a medication because they feel fine. You don't feel high blood pressure. Again, there are no symptoms. So please don't stop treatment without speaking to your healthcare provider. Medication is important, but lifestyle matters too. So here are some ways that you can lower your blood pressure naturally, possibly without taking medication. The first is you want to reduce your sodium intake. Follow what's called the DASH diet, DASH, and you can look that up online and find more information about it. Of course, we always tell people eat the rainbow. Increase your fruits, vegetables, water intake, physical activity. You want to get about 150 minutes of physical activity per week. Even losing 5 to 10 pounds can significantly reduce your blood pressure. You want to limit alcohol. If you smoke, please stop. That is damaging your blood vessels and making your heart work harder. Improving sleep. This is something we don't talk about enough. Sleep is so important. It's when your body regenerates, your cells regenerate, and it is important to get not only an adequate amount of sleep, but good quality sleep. Managing stress. I was just talking with our pharmacy student here about making sure that we talk about stress during our consultations because it is so important and it affects your blood pressure. Now, I want to pause right here and say this clearly. Medication and lifestyle together provide the strongest protection. It's not either or, it's both. And for some individuals, especially in our community where stress, access to healthy foods, even safe spaces to exercise may be limited, we have to acknowledge the social determinants of health. Chronic stress, financial strain, food insecurity, all of these impact your blood pressure. So this conversation is bigger than just numbers. It's about equity, it's about prevention, and it's about empowering people with knowledge. So here's your call to action as we close out Heart Month. Know your numbers. If you don't have a blood pressure cuff at home, consider getting one. And if you have one, bring it to your next appointment to make sure it's accurate. If you're on medication, take it consistently, the same time every day. If you've been told that your blood pressure is a little high, follow up, monitor at home. And if you need support, education, or monitoring, reach out because prevention doesn't happen by accident. It happens by intention. And high blood pressure may be silent, but we don't have to be silent about it. This Heart Month may be ending, but protecting your heart is a year-round commitment. Your heart matters, your brain matters, your kidneys matter, and your life matters. Thank you for joining this week's Meds Plus Medical Minute. I'll see you next week as we continue to engage, educate, and empower you to take care of your health. I'll see you next time and have a great week.
At Meds Plus Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. Meds Plus Consulting Pharmacy and Wellness Center.